Howdy everyone, Matt and Matteo here, coming at you with another orthopedic special test, and this one is for the SI joint. It is the thigh thrust test. Now the earliest paper I could find on this test seems to come from a paper in 1994, and what they were doing in this research article was doing several pain provocation tests for the SI joint to diagnose SI joint dysfunction. And so they said in this paper that they are performing a posterior shear of the sacrum using the femur to produce a pain to therefore, like I said, diagnose SI joint dysfunction in people with low back pain. To perform this test, you have the person laying supine, laying on their back. Matteo said he's perfectly fine doing that. You flex the knee and the hip up to 90 degrees. Now you want to stabilize under the sacrum. So you can either reach under and stabilize there, or if you have a Nordic wedge like I do, or rolled up towel, place it right up under the sacrum right there, and you apply a downward force. Now I will tell you there's a couple ways to do this. There is one where you bring the person up and you come into a little adduction and perform it, but Laslett also talks about just keeping it more pure here without the adduction because there is a discomfort that can be caused to the patient. And a positive is a production of their symptoms. And getting into the research for this test, I will tell you this, with SI joint test, it really looks like these tests do not exist on their own in paper, so that you just can't find a paper that looks like one test. They're often done in clusters, so they're just doing a bunch of these. But I will say, it looks like over time, they're saying like this test is a pretty good one to do in these clusters. However, the biggest thing that really comes out of the research for the SI joint seems to be like there's a positive cluster of tests, and you do a good thorough history with it. So there you go. That is the thigh thrust test. What do you think about it? Do you use it? Do you like it? Maybe we need to look at it on its own. Anyway, let us know down in the comments what you think. And like always, take care of yourself. Take care of your patients. We'll see you next time.